Ontario's Minister of Labour was asked that very same question, why his government waited to provide paid sick days. He pointed to the federal government, arguing the province was waiting on the feds to beef up their own sick leave benefit.
We were, working with them all the way along, and as the Minister of Finance alluded to, we were disappointed with the federal budget. We thought that they were going to come through, but clearly they didn't. We're stepping up today with a generous paid sick day program for workers in Ontario to ensure that we get through COVID-19 and workers stay home when they're sick.
Dominic LeBlanc is the federal minister in charge of the Fed's relationship with the provinces. Hi, Minister. Good to see you. Thank you for making the time.
Good evening, Vashi.
Ontario's making this long-awaited announcement when it comes to paid sick days in that province, and there are certainly a lot of questions for the provincial government there about what took so long. But they had been, along with other provinces, including BC's government, asking the federal government, your government, to close some pretty obvious loopholes with the federal sick leave benefit. The last time you were on this program, you said you were open to that, but ultimately it looks like your government decided against it. Why?
So I had a conversation with respect to the situation in Ontario with Premier Ford last evening. It was a positive conversation. We certainly share the view of Ontarians, but more importantly, doctors and other experts who've said this is a critical part of arresting the community transmission which takes place in workplaces, having access to paid sick leave. A lot of these low-wage workers don't have that access. One of the challenges, Vashi, is that provinces under their legislative authority are able to mandate in the vast majority of workplaces paid sick leave. We did so for federally regulated industries, but it's a small percentage of workers. It's things like airlines, banks, telecommunications companies. So our sick leave was always designed to sort of fill a gap if you're a gig worker or somebody who literally falls through the cracks. The best and most effective way is to have employer-driven, mandated by law access to sick leave. And I think that if the Ontario government moves in that direction, it'll be very positive.
Is that what the Premier conveyed to you in your conversation, that he was willing to do so? Because he had so far resisted.
Yeah, no, the conversation wasn't in that level of detail. It was basically how could the two governments work together? We have a program which we doubled in terms of 4 weeks instead of 2, which was originally there. I reminded him that the wage subsidy also had provisions that we would compensate employers for sick leave benefits if they were benefiting from the wage subsidy. So it was a very constructive conversation around, look, how can the two programs work together to provide the best protection possible, but also the need to move quickly. And that's one of the challenges, certainly that we understand. Obviously, the faster that these benefits can be available to workers, the safer everybody will be. So that was the nature of the conversation. But I know my colleague, the Finance Minister, Chrystia Freeland, has been in active and ongoing and detailed discussions with the Ontario Finance Minister, and the Premier and I acknowledged that as well last night.
So just so that I'm clear and our viewers are clear, for example, Premier Horgan had been asking for similar changes to the federal program. And by that, I mean more money, because the current amount of money that people were able to access was less than minimum wage, an easier sort of time qualifying because you had to miss half of your work week in order to do so, and less delay in getting the money to people. It took about 3 to 5 days for people to access the money provided through the benefit. Is it, and has it always been your contention that the federal government would not be able to do any of that because it's easier for the provinces too? Like, I'm just wondering, because nobody had really said that explicitly prior to now.
Yeah, and as I said, one of the challenges, the government of Canada can't legislatively force employers to offer these benefits to their employees. That's the most immediate and reliable way for people to have access to sick days. So when they have COVID symptoms, or when they may have been in contact with somebody who tested positive, they can isolate and not face the unreasonable economic uncertainty where they would have no income replacement. So our program was designed, as we said, originally just for 2 weeks. We extended it to 4 at $500 a week. really to try and fill the gap. What we had done 2 years ago, Vashi, was legislate for workplaces over which the Government of Canada has jurisdiction, mandated sick leave for employees. So the best way is for provinces to do the same thing, but also, and this is what Premier Ford and I discussed, and we have a meeting with all the premiers tomorrow evening, a First Minister's meeting a Thursday evening. One of the things we'll look at is how can these programs be complementary. We don't want to be duplicative, but we want to obviously support decisions that provinces can make in their own jurisdiction as well.
I guess just one more question on this. There was an opportunity, like the program that your government designed, I get it. It's looking at filling gaps, but it could have better filled those gaps. You saw that the uptake at the end of March, according to the CRA, was just 1/6 of what your government projected it would be. Why not address those gaps and then worry about what the provinces do?
Well, as I said, the most reliable way that employees can have access to these benefits is through the employer. And provinces have the legislative authority to put those measures in place. In the vast majority of workplaces, we don't. We did it for federally regulated industries. So what we've said to the provinces is they should look at how legislatively they can affect this sick leave benefit as quickly as possible. And again, we've shown already by doubling the number of weeks that we're open to making adjustments in the federal benefit. But we think provinces now need to find a way in their own jurisdiction to complement the federal program. But we're always continuing to look at suggestions of how federal programs can also better serve people.
I wanted to also ask you about the military, because I know that it's being deployed to Minister Ontario already. I heard the Prime Minister say that the federal government stands, ready to help Alberta if necessary with the military as well. Has there been an ask?
My understanding is there hasn't been a formal ask yet, but obviously there are ongoing discussions between provincial public safety departments and my colleague Bill Blair's department. That's the channel on which through which these requests are made. We've already done a pretty exhaustive inventory of what federal supports in terms of healthcare professionals, so critical care nurses, doctors, technicians, what we would have in terms of federal employees, also what the Red Cross could provide provinces and territories. So we obviously stand ready to say yes very quickly to any requests that would be possible to supplement what provincial healthcare workers are able to deliver.
When you're also talking about supplementing provincial programs, the final thing I want to ask you about is long-term care. We know it's been a huge issue throughout the first two waves and into some parts of the country in the third wave as well. We saw today an analysis by the Auditor General in Ontario that was pretty scathing in how underprepared the long-term care homes in Ontario in particular had been for what occurred during the first and second wave. Your government has committed in the budget $3 billion over 5 years, I believe, starting in 2022 to implementing long-term care standards. When you hear how bad the situation is, and again, we know it is in Ontario, we know it's in other places as well, do you not need to up that amount of money and speed up that timeline?
So we have already given hundreds of millions of dollars to provinces and territories already last summer, almost a year ago, in the Safe Restart Agreement. So we have made available hundreds and hundreds of millions of dollars to the provinces to improve care in these long-term care facilities. As you know, we've deployed the military in some cases directly into long-term care homes, but more recently, members of the Canadian Red Cross under contract to the Government of Canada have been supplementing what the women and men who work in these facilities can do in terms of care. We certainly recognize the need. My mother was in a long-term care home until she died a little over a year ago. There's no doubt that the workers are in a precarious position, and there can be improvements in the care, and that's true right across the country, Vashi. So what we're doing is working with the National Standards Association to get the best advice from doctors and other professionals in terms of infection control or other medical measures that would make these facilities safer, working with them to try and come up with common standards. And then, of course, we'll sit down with the provinces with $3 billion available to see how we can work collaboratively to raise the standard of care in these homes.
Respectfully, though, Minister, that sounds like a very long process. And a few months ago, you were on this program saying you thought it could be weeks, just weeks before long-term care standards are implemented. When you think about the people who are still in those homes and still subject to the conditions as outlined by the Auditor General today, can you really kind of look them in the eyes and say, well, wait a few years, maybe there'll be standards about your care then?
Well, first of all, a number of provinces have said they're, in principle, not interested in working with us on standards. So we start from the position that that's the wrong answer. We think if a group of experts come together, like the National Standards Council, and get the best advice of scientists and doctors in terms of how to increase the standard of care across the country, provinces will want to work with us to access that federal money. But as I said, Vashi, hundreds of millions of dollars have already been transferred this year to provinces to improve the standards in terms of long-term care homes. And we'll continue to do whatever is necessary to improve those standards. But we need provinces to work with us.
Okay, Minister, I'll leave it there. I appreciate your time as always. Thank you. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.